In this video, our channel has discussed a very important topic of cholesterol and what is related with heart disease. And cholesterol is a waxy substance found in our blood. Our body needs cholesterol to build healthy cells. But when problem arises, when high levels of cholesterol can increase our risk of heart disease. With high cholesterol, you can develop fatty deposit in our blood vessel. Eventually, this deposit grow, making it difficult for enough blood to flow through our arteries. Sometimes, those deposits can break suddenly and form a clot that causes a heart attack or stroke. And high cholesterol can be inherited, but it's often the result of unhealthy life choices and which make it preventable and treatable. A healthy diet, regular exercise, and sometimes medication can help reduce high cholesterol. And what is the symptoms of high cholesterol? There is no symptoms. High cholesterol has no symptoms. Only a blood test is a way to detect if you have it. And when to see a doctor? It's ask your doctor if you should have a cholesterol test. And children and young adults with no risk for heart disease are usually no risk factor for heart disease are usually tested once between the ages of 9 to 11 years and again between the ages of 17 to 19 years. And resting for adults with no risk factor for heart disease is usually done every 5 years. If your test results are not within desirable ranges, and your doctor might recommend more frequent measurement. I will show the recommended ranges of LDL, low density lipoprotein, high density lipoprotein, triglyceride, and total cholesterol level. And what I want to say, your doctor might also suggest more frequent test if you have a family history of high cholesterol, heart disease, or other risk factors such as smoking, diabetes, or high blood pressure or hypertension. And how would we know that we suffer from in high cholesterol level? A blood test to check cholesterol levels called a lipid panel or lipid profile typically reports total cholesterol, and this is the normal range, borderline range of the total cholesterol level. Another one is low density lipoprotein cholesterol level. This is the ranges of low density lipoprotein cholesterol. Another one is high density lipoprotein cholesterol. This low density lipoprotein is bad cholesterol, and this high density lipoprotein, now I am showing the normal range of high density lipoprotein or good cholesterol level. And another one is triglyceride. This is the ranges of triglyceride in our blood, a type of fat in the blood. And from this chart we can know the normal value, the borderline value, the affected value of the total cholesterol, LDL cholesterol, HDL cholesterol, and triglyceride. And this cholesterol is measured in the categories, in some categories, that is the total cholesterol, LDL cholesterol, HDL cholesterol, and triglyceride. And the struggle for most people in balancing these levels while total and LDL cholesterol levels should be kept low. Having more HDL cholesterol or good cholesterol can offer some protection against a person developing heart related illness, including heart attacks, stroke, heart failure. Cholesterol level tend to increase with age. Doctor recommended taking steps earlier in life to prevent dangerously high levels of cholesterol developing as a person ages. And children are least likely to have high levels of cholesterol and only need to have their levels checked once or twice before they are 18 years old. And typically, men tend to have higher levels of cholesterol throughout life than women because uh, woman has a protective factor, that is estrogen, and estrogen has a role to decrease the level of LDL cholesterol level, and a man cholesterol level generally increase as they age. However, women are not immune to high cholesterol. A woman's cholesterol often increases when she goes through menopause. And what are the causes to elevate cholesterol level in our blood? And cholesterol is carried through our blood attached to proteins. And this combinations of proteins and cholesterol is called lipoprotein. And there are different types of cholesterol and based on what the lipoprotein carries. And they are low density lipoprotein LDL, LDL or blood cholesterol. This is our blood cholesterol, transported cholesterol particles throughout our body, and LDL cholesterol builds up in the wall of our arteries, making them hard and narrow. Another one is high density lipoprotein. High density lipoproteins, another name is good cholesterol, and it picks up excess cholesterol and takes it back to our liver. And very low density lipoprotein also present in our blood. And a lipid profile also typically measure triglyceride, a type of fat in the blood. Having a high triglyceride level can also increase our risk of heart disease. And factors we can control, such as inactivity, obesity, and an unhealthy diet, contribute to high cholesterol and low high density lipoprotein cholesterol, which is good cholesterol in our body. And factor beyond our control might play a role too. For example, our genetic makeup might keep cells from removing LDL, low density cholesterol, or bad cholesterol from our blood efficiently or cause our liver to produce too much cholesterol. And what are the risk factors that can increases our risk of blood cholesterol? Included poor diet, eating saturated fat found in animal products and trans fat found in some commercial baked cookies and crackers, and microwave popcorn can raise our cholesterol level. Foods that are high in cholesterol, such as red meat and full fat dairy products, will also increase our cholesterol. And obesity, another factor is obesity. Having a body mass index of 30 or greater puts you at risk of high cholesterol. From our skin, we can calculate our body mass index by using this equation. And another one is lack of exercise. We know that exercise helps boost our good cholesterol, that is high density lipoprotein, while increasing the size of particles that make up our LDL or blood cholesterol, which makes it less harmful. Smoking, cigarette smoking, damages the walls of our blood vessels and making them more prone to accumulate fatty deposits. Smoking might also lower our level of good cholesterol. And another one is age, very important factor because our body's chemistry changes as we age, and our risks of high cholesterol climbs. For instance, as we age, our liver becomes less able to remove blood cholesterol. And high blood sugar contributes to higher level of dangerous cholesterol called very low density lipoprotein or VLDL, and lower HDL cholesterol, that is good cholesterol. And high blood sugar also damage the lining of our arteries. And high cholesterol can cause a dangerous accumulations of cholesterol and other deposit on the wall of our arteries, that is called atherosclerosis. And this deposit or plaque can reduce blood flow through our arteries, which can cause complications such as chest pain. If the arteries that supply our heart with blood, that is coronary artery, are affected, and we might have chest pain, that is angina, and other symptoms of coronary artery disease. Another complication arises, that is heart attack. If plaque, tear or rupture, a blood clot can form at the plaque rupture site, blocking the flow of blood or breaking free and plugging an artery downstream. In blood flow, if blood flow to part of our heart stop, we will have a heart attack. Another complication is stroke. Similar to heart attack, stroke occurs when a blood clot blocks blood flow to part of our brain. And in this video, I discuss some prevention, but in our next video, I will come with the preventions of high cholesterol level. And in this video, I discuss very little bit of prevention of high cholesterol level management. And the same heart healthy lifestyle changes that can lower your cholesterol can help prevent you from having high cholesterol in the first place. To help prevent high cholesterol, you can eat a low salt diet that emphasizes fruits, vegetables, and whole grains. Limit the amount of animal fats and use good fats in moderation. Lose extra pounds and maintain a healthy weight. Quit smoking. Exercise on most days of week for at least 30 minutes. Drink alcohol in moderation if at all. And managing stress is very important in our life, because stress enhances the chances of heart attack or stroke in our life. So I think this video will help you to understand the causes, the complications, and the risk factor of high cholesterol. In our next video, we will come with the management, lifestyle management in high cholesterol level in our daily life. If you understand this from this video, please share this video to among those patients who suffers from high cholesterol level. And if you get more updates from our channel, please subscribe our channel and press the bell icon, and please like our video. Thank you from Knowledge of Life Edu.